The MAHA movement is extremely important to me, which is the reason why I'm incorporating a number of tenets as I'm running for governor to help make Michigan healthy again. The way to increase quality of life and the way to decrease cost of living is to have healthier Michiganders. This is something I believe very strongly in and something that I haven't wasted any time doing something about. I'm very proud that I was able to support my friend Anna Paulina Luna's amendment to the most recent farm bill to remove protections from organizations that shielded pesticide producers from liability. When you have so many younger people with increases in cancer all over the nation, I believe we deserve the right to understand what's going on. And those who have been afflicted have a right to defend themselves. But before that, we need to make sure that we're addressing the issues so that we don't have to rely on the sick care cartels to keep us healthy and safe. I also believe very strongly in patients deserving price tags. That's increasing transparency to hold the insurance companies and the hospitals and the pharmaceutical companies and the PBMs accountable for their cartel-like behavior. I'm leading that effort in Congress, in the House of Representatives, and I'm going to be taking that to Michigan because I believe that you cannot have accountability without transparency. And when you give the people the resources to control their own health care and their own decisions, then it's going to have better outcomes for everyone. I believe very strongly in making Michigan healthy again, and this comes from, frankly, my own lived experiences. My wife had cat scratch fever, Bartonella as a result, and there are tick-borne illnesses in our families. Ticks have gotten absolutely crazy and out of control. And as a result, my children also have tick-borne illnesses, Lyme disease as well. We didn't know this until after my wife did extensive amounts of research and recognized that symptoms like asthma, ADHD, restlessness, anxiety, GI issues were all attributable to tick-borne illnesses. And not until we went to an integrative health specialist did we learn exactly what had been going on. And then continuing to do research, we recognized that it was the things that were in our environment that were making us sicker. How much more so are these issues afflicting the rest of society? As governor of the state of Michigan, we're going to be increasing access to testing and resources because even if you test, there are some tests that would give you false negatives. And again, when you look at other areas that may be under-resourced, socioeconomically depressed areas, whether rural or urban, needing the resources to be more healthy, we need to do everything we can to have more clean food, reducing exposure to things like synthetic dyes and PFAS and pesticides and other harmful chemicals. And it's adding insult to injury in places like Michigan, where you can look across the Detroit River and see Canada, a place where they're selling the same McDonald's food, but it would be illegal to sell in Canada what we sell in Detroit. Yes, because they have rules around what qualifies as food. By working with our farmers and supporting through voluntary, restorative, regenerative agricultural practice that improves soil health, protects water quality, and strengthens local food production, these are things that we can do to increase health outcomes by watching what we're putting into our bodies as well. Making Michigan healthy again also includes not just our physical health, but our emotional and our mental health as well. I plan on working very, very closely with community mental health, making sure they have the resource to combat the mental health and addiction crises that we're facing as a nation. And as a combat veteran myself, I understand very well the unseen wounds of war that so many have succumbed to, not just our veterans, but also family members and loved ones who have issues of addiction and mental health that our hospitals, that our schools, and that our jails weren't designed to handle. So again, taking a comprehensive approach, an integrative approach, a community-based approach to make our healthcare system affordable again, putting prevention first, and making sure that we're listening to our experiences, listening to the people, what we're putting into our bodies, and holding the sick care cartels accountable for what they're putting into the food system will be just a start for how Michigan will address this. And when we make it happen, and when we make it better, and we make it work in a state like Michigan, then we can definitely take this as a platform to leverage to the rest of the country.
Thank you so much, John. That was just great. That's it's the perfect MAHA speech, and just right on target. And it's very, very clear that your goal to lower cost, expand access to healthcare, protect informed consent, improve food quality, reduce toxic exposure, rebuild long-term health. I mean, all of those things are just so in line with everything that the MAHA movement stands for. So thanks so much for coming on.
Thank you so much for having me.
So once again, John James really champions lowering costs, expanding access to healthcare, protecting informed consent, improving food quality, reducing toxic exposure, like I said, rebuilding long-term health, and strengthening domestic pharmaceutical manufacturing to protect us in times of war or other national disasters. So we at MAHA Action are therefore proud to endorse John James for governor of Michigan. I think he'd make a great MAHA governor. He supported the MAHA movement in Congress by voting to remove pesticide liability shields from the Farm Bill, by backing restrictions to prevent foreign adversaries from purchasing American agricultural land, and advancing healthcare transparency. So because the time for the MAHA movement, the MAHA change is right now, we need to elect members of Congress, but also, we need to elect governors all around the country who are really in line with the MAHA movement. And this is certainly one of those cases.